This is Life Talk with Muriel Desar. Talk 100.3.
11:36 on the clock. A very, very good morning to you and amazing यार. मतलब इतने messages आ रहे हैं. People advising me, ठीक है, we will get to that post at 12 o'clock. पर अभी के लिए, I told you, I have an amazing guest in my studios and she's none other than Dr. Preeti Rupam Kantwala, a specialist dermatologist है NMC Medical Center Ajman से. And आज का जो topic है, it is about anti-aging, something that we really want to know. A very, very good morning to you, Dr. Preeti.
Good morning. I'm Dr. Preeti, currently working with Ajman Medical Center, NMC. I'm a certified dermatologist and having almost 13 years of experience. And today's topic about aging. So a little bit of inputs about what aging is and like an insight to what you can do, the pros and cons and how it occurs. So from that, we will go ahead and discuss about the topic.
Absolutely. First, Dr. Preeti, tell me, how old are you, 20 or 25?
Aging is just a number, I would say.
Because you have such a flawless skin.
Thank you.
If you had not told me that, you have kids, I would have not believed.
Yeah, so you do need to take care of your skin and you need to understand like why aging happens. So as they say, aging is just a number, but when it starts kicking, you need to understand like, yeah, you need to take care of your skin in the early ages, because I see the youngsters, they are too much into their career and other things, and they do not take care of their skin. So the main purpose here is to discuss this particular topic so that people get aware and they can take their basic measures to take care of this concern.
Right. Are there any factors, Dr. Preeti, that actually, relate straight up to aging? Some external, some internal factors?
Yes, very rightly said. Like we say, when we say aging, there are intrinsic and extrinsic factors, as we put it. So intrinsic means something which is going inside your body, and extrinsic, which plays a very major role, is the external factors. So just summing up a few of these things, one is your lifestyle plays a very major role. So like we say, like the currently the trend which goes on where you're eating too much of junk food and unhealthy foods, which lots of carbs and sugary items, that also tends to cause aging concerns, because these are toxins which you are actually consuming. Apart from that, because of a hectic lifestyle, people are not consuming enough of water, so that dehydrated skin over a period of time is going to cause you aging. Plus your lifestyle, like if you're too much of stress, pollution, then your smoking, drinking habits, all that will contribute to it. And I see a lot of people sleeping late at nights. They sleep at 1 and get up at whatever. Like
वो नींद नहीं आती है डॉक्टर. मतलब बहुत कोशिश करते हैं हम कि 11 बजे is like a maximum cut off for me at least, कि मैं at least 11 o'clock सो जाऊँ. But वो क्या है ना, वो reels इतने मस्त आते हैं कि वो नींद आती नहीं है.
Yeah, so that if you want to train your skin and your lifestyle, you need to put in some discipline. Okay, it's fine. 11 is okay, accepted. But then I see people sleeping at 1 and continuously on the computer and your laptop. So understand that even these radiations, it's just not the sunlight. It's even these radiations which affect your skin. We say that only, okay, I'm just indoors, I don't need to use a sunscreen. But that's a total wrong myth, because these UV lights which you are sitting in, as well as the computer radiations, your mobile screens, that also affects your skin. So yes, you need to sleep properly. So we say at least 6 hours of undisturbed and a healthy sleep, because if your sleep cycle is disturbed, your circadian rhythm is disturbed, and that over a period of time, I'm not saying just skin aging, it ages your overall body as well.
Right. Now, doctor, you have to tell me a little bit about, are there any particular skins that age faster? Maybe, like the brown skin or someone with a wheatish complexion. Does that also matter?
Yeah, to some extent. See, when we say an Asian skin, they have something known as melanin, which is like a protective layer to your skin. And so, like we say that if you say the Caucasian skin, or the ones which have like a skin type of 1, which is like hardly any melanin, they tend to age faster. If you see the foreigners or the western sides, they tend to age faster. They see a lot of fine lines and wrinkles at an earlier age, along with the age spots. So we say that the Asian skin is a little bit blessed because of the melanin. It acts like a sun protector, but that doesn't mean that you should not be using a sunscreen. But at the same time, if you have a very dry skin, you are more prone to aging faster, because a dry and dehydrated skin is going to show fine lines and wrinkles at an earlier age compared to if you have a oily or a combination skin.
Right, doctor, as we're speaking, आरना से एक WhatsApp आया है. How do you tailor treatment plans to individual patient needs and preferences?
Yeah, so when we are seeing the patient, we first do an analysis of the skin, like what type of skin you have. Is it a dry combination or an oily zone skin, acne prone skin? So all that is taken into consideration. After that, we customize, in the sense we tell you starting from your face wash, to what type of face wash you should be. Like, if you have a very dry skin, then we suggest something like soap-free cleansers. So these do not foam like cleansers. It's a very mild cleanser. So this will not dry the skin, but at least it will be cleaning or deep cleansing the skin. And then, so according to that, the use of your moisturizer, your sunscreens, then also comes in your actives, wherein we suggest, like, if you have a mature skin, then hyaluronic acid is a very good serum which helps to hydrate and plump up the skin. So there are particular times when we have to apply. Now there is a very crazy fad about retinol. People are using retinol like just crazy. They just apply it like.
So what is retinol now?
Retinol is a serum. Like, we say we have to exfoliate the skin, because over a period of that 1 week we have applied so much of makeup, and also the dead skin cell layer builds up, and we need to exfoliate the skin. So retinol is something which, it's like a serum. It's a vitamin A basically, and it's in a serum form, and this helps to exfoliate the skin, but it has to be done just once in a week, max to max 2 times in a week, not more than that. It is not a regular or a daily base serum that is recommended, because that tends to make the skin again dry, and that can cause irritation, and you can also get flare up of your acne. So
Right.
it is like a double-edged sword. So you have to use it in a right way and take it in the right guidance.
Right. Now, Dr. Preeti, I have also another question. Now, there are some people who are, I think, over the top with their products. हम ये भी product use करेंगे, सुबह को ये, दोपहर को ये, रात को ये, and they're constant about it. And you see a lot of these influencers doing it, different products they'll touch on their skin, just for the camera. Is that a good thing? Is that, would you advise something like that? Or
Yeah, see, actives usually work best in the night. So you have to first and foremost cleanse your makeup.
what
very
is an
thoroughly.
active? Let's start with
Active
that.
is like a serum. Like, you have active ingredients in it. Like, you have azelaic acid, then as I said, hyaluronic acid. Azelaic is something which is an anti-inflammatory property, so it can be given for those who are having acne problems as well as acne spots. So it works in a dual way, for spots as well as for acne. So that is one. Then you can have vitamin C, which is again for skin lightening. So as I said, according to the concerns, the products have to be customized and given to you. You cannot apply everything and anything for that matter. It has to be told in the right way, and you have to apply it in the right way.
Right. Now, also, we've heard so much about early signs of aging. Is there anything we can do to kind of reverse aging or stop aging?
See, aging is an ongoing process, right? So as I said, when I enumerated the extrinsic factors, if you work on that at the early age, definitely your is like what you eat shows on your skin, or what you take shows on your skin. So if you're giving a discipline to your skin and your internal health, like drinking, the first time when you get up in the morning, you should be consuming water, not directly taking a cup of tea and coffee. That is the total wrong thing to start your day with. So from the day you start, you should be detoxifying your body. So you should be drinking at least 2 glasses of water. Lukewarm water, good enough. If you can have detox drinks, that is all the more better. And then, so that is about your eating habits. Like, you have to cut down on your intake of caffeine, like coffee, and too much of tea intake as well. Green tea is fine, but then again, anything in excess is going to harm your skin. So you have to discipline your skin, and at the same time, the routine of your products which you're using, that also matters, and what you eat also matters. So a balanced diet. Now people are also doing this intermittent fasting. Yeah, to some extent it is good, but then if you are not giving the right calories, and if you are not doing it in the right way, you are going to backfire your body. And I've seen that people also look more old because of sudden loss of weight, and that also makes the skin very loose, and they lose the elasticity, their charm, it looks so dull. So it has to be done in the right way. So that is the thing.
Absolutely. That's exactly what Dr. Preeti is saying. Now, we will continue our discussion with her in
Live Talk 100.3.
11:51 on the clock. A very, very good morning to you. We are in conversation with Dr. Preeti. Rupam Kantwala, specialist dermatologist है NMC Medical Center से अजमान में, and we are talking to her about anti-aging. अभी कुछ देर पहले ही we asked her, can you reverse aging? Well, she gave us a very in-depth answer. But अभी के लिए लिए you've got to break this down for me, doctor, कि बहुत सुना है हमने fine lines, wrinkles, deep lines, समझ तो बिल्कुल नहीं आया. What does it really mean?
Okay, so जब हम बोलते हैं कि fine lines and wrinkles, or when you say something like fine lines and wrinkles and something known as deep lines and wrinkles. So fine lines जो आपको दिखता है या it is just seen on the face, like you can see when you smile, these are these lines which are more prominent, particularly around the eye area. When you look on top, it is like a deep line. So these are dynamic lines, where what we mean is when you're doing the expression, these are also known as expression lines, right? Apart from that, something known as your deep lines in the nose, just next to the nose, that is the nasolabial lines, as well as just next to the corners of your mouth, you see the deep lines happening. So these occur because of gravity. So gravity is when over a period of time, like the sleeping position also matters. Like some people sleep on one side, so you see those lines are more deeper on that side, right? So that is also like they are not aware of this, but yes, this is also one of the factors. So as I said, fine lines is what is visible, and deeper lines is, yes, it is because of gravity, and sometimes it is also a part of the aging process. Now deep lines also, as I said, one is gravity, and as you age, there is something known as a shift of your ligaments. There is ligament and fat pads. So when you have a young skin, it is good amount of the ligament holding the skin as well as the other underlying tissues. But as you start aging, because of the lifestyle, because of the gravitational thing, and you're exercising and all that, for that matter, that there is a shift as your body ages, even your skin ages. So there is a shift of your ligament and the fat pad, which makes a skin aging and sagging of the skin.
Right.
So that is how we tell that, okay, so this is a saggy skin and this is just fine lines and wrinkles. So that is how we can differentiate these things, for that matter. So when we talk about the treatment parts, again, these things are analyzed in a particular way so that we can give you the right guidance. So if you have something like fine lines and wrinkles, as I said, moisturizer, actives will definitely, like hyaluronic acid helps to treat fine lines to some extent. That is the textural changes. But if you want to correct the expression lines, then you might have heard about the botulinum toxin, which is very much in the market now, wherein we relax the muscles of the expressions. So that helps to decrease the fine lines and wrinkles to a good extent.
Right.
And so these are the newer, what do you say, I won't say in surgical procedures, but non-surgical procedures to take care of your concerns in the primary stage, or to some extent to improve that particular concern.
So is this what non-surgical procedures mean when what you just mentioned?
Yeah, now there is an array of non-surgical procedures. I've just told one aspect of it. So now people are also concerned that these are injections, so I don't want to do that. So yes, so there are some other machine-driven treatments wherein we use lasers, which helps to rejuvenate the skin. So there is like the radio frequency, then there is the CO2 laser, the carbon dioxide laser. Then the basic thing what people are doing is hydrofacial. Yes, that definitely helps, because there are a lot of serums also used. It's like a very sophisticated procedure, like a facial, but a little more advanced technology than the facial. So
like what happens in hydrofacial?
See, in hydrofacial, it is a combination of cleansing, exfoliation, then active serums are used. For the dehydrated skin, there are different serums. For the aging skin, there are different serums. For acne-prone skin, there are different serums which are infused into the skin. So then there is a light which is given, which helps to calm down the skin. So that has its different factors, and there is a mask application. So this is a basic hydrofacial, which is more advanced than a normal facial. So that is one thing. You can take it like maybe once in a month or 2 months. Apart from that, the other treatments which we say for anti-aging particularly, the most thing talked about is dermapen. That is, we are using a PRP, that is platelet-rich plasma, wherein your blood is taken and it is separated, and then what is the plasma which we get. These are very good in growth factors. So what is growth factors? It helps to improve the texture of your skin. So that is, we are using a dermapen to infuse it into the skin. And dermapen is just like a rotating device which helps to give very minute punctures into the skin. It's like a pinpoint like thing. It's not very painful, and you get very good results. So it is like a basic thing wherein you don't want something like injection into your skin. But yes, that you can try that, but you will get best results when you start at an early age. So what I mean by early is maybe around 25 to 30s, you can start taking this treatment maybe once in a month or once in 2 months to maintain your skin. So we divide that treatment as well.
Right.
Yeah.
And doctor, now I have this question. It's a very basic question. So the understanding is ना, जैसे कि आप expensive products use करते हैं, you buy expensive cosmetics, expensive creams. Is that more beneficial than the regulars that you get in store?
See, as I said, like these are medicated products what we prescribe. So, yeah, if you are taking it from the pharmacy or from the stores, you have to see the active ingredients in that. Like there are some good company products which can be used, and they are tried, and you should be seeing that it should be dermatologically tested. So these products are safe for your skin, but yes, you have to take the doctor's guidance to take it ahead.
Right. Now, doctor, what procedures are adapted for the correction of fine lines and wrinkles?
Yeah, so if you're having these expression lines, then the botulinum toxin treatment is what is given. So these are basically a dose of that particular material which is given into the skin, and that helps to relax the expression line. So if you are having very deep frown lines, at the 11 lines which we call on the on the front, then the linear lines on the forehead and the crow's feet. So these are the basic things which people are really concerned. So this is the treatment for the correction of these lines. And if you are having a very saggy skin, then we have dermal fillers and thread lifts. So these are again advanced treatments which can be like if you're doing a dermal filler, the result lasts for maybe around a year and a half, maximum 2 years, because that also depends upon your metabolism, your lifestyle. So that is the thing. And a thread lift is something which again is to correct the sagginess of the skin, but it has to be done by the right person. The right technology and the right technique is important so that you get the best results.
So, are these treatments only for women or do men as well come to you?
We see a lot of men also doing these procedures, because now I think the awareness is more, they are more concerned about their skin and how they look. So yes, we do see few I mean the male market also building up in this direction.
Right. Now, how does exomes and PRP help to prevent the aging of skin?
Yeah, so as I said, PRP is just it's your natural growth factor. It's taken from your blood, and we are separating that thing to give you the concentrated growth factor, and it is infused into the skin. So this is basically like stem cells, which helps to regenerate the skin.
Right.
So what happens with aging is there is degeneration of your DNA. Okay, so this is something which is like a building block for your skin and the body. So when we are putting this into your skin, it helps to multiply your collagen and elastin. So it boosts up your collagen and elastin, thus helping to improve the complexion or the texture of your skin. Like we also see a decrease in the pigmentation, in the fine lines, and even the texture. So those who have a very dry, dehydrated skin, this also gives good results. We are also using this for acne scars. So PRP along with the dermapen can also give good results in acne scars. And of course we can do it with the laser also. So it's like a versatile thing which we can use along with many other gadgets available.
Right. Now, my final question, because we're running out of time. What are neurostimulators and dermal fillers? What are the monothreads and its role in anti-aging?
Yeah, so neurostimulators, as I said, like the botulinum component which helps to relax the expression lines, that is one. Secondly, dermal fillers is like a material made up of hyaluronic acid. So as I said, hyaluronic acid is already present in your body, but as you age it starts decreasing. So we are using the same thing and giving it in particular areas where there is a volume loss. So those because of volume loss, is like again it helps in the collagen and elastin buildup. And there are as I said, the other devices which are also used to improve the skin texture and decrease the signs of aging.
Right, doctor. Now, final word of advice before you leave from here. How can we take care of our skin in a season like this, which is winters in the UAE?
Yes, so first and foremost, starting with your cleansers, use very mild cleansers, not too much which exfoliates, or something like salicylic acid which tends to dry the skin. Yeah, if you're having an acne prone or a severe acne, you can use salicylic acid component face washes. But otherwise, if you have a super dry skin, then you just use a mild cleanser, which we call as soap-free cleansers, followed by that a moisturizer. If you have an aged skin, you can use a hyaluronic serum to top it up. So that.
When you mean aged skin,
Yeah, so
what
I say
age
dry.
bracket?
If you have a dry skin, you have a few fine lines, wrinkles coming up, and you feel that okay, like my open pores are looking more prominent, and you see a few fine lines, you can use hyaluronic serum, which helps to plump up the skin basically. So that you can use it in the night time. And sunscreen is mandatory, so you have to use at least an SPF 30 sunscreen on a regular basis. And of course, your diet, as I said, keep on saying that hydrate your skin, drink 3 liters of water. if I say 3, you'll come out to at least 2. So you have to drink water, because in winters people say I don't feel thirsty.
Right.
So that is again going to damage your skin, because it's the weather, it's very dry. Plus, if you're not drinking water, it's going to be dehydrated, and again you can see the signs of aging coming up. So water, and of course your lifestyle. So your intake of salty foods have to be reduced, and try to have more of your good amount of fruits, salads which have a good amount of flavonoids, lycopene, which helps to plump up your skin and give you the best.
Right. Thank you very much, Doctor, for taking time out, coming to our studios, and for educating us today on healthy skin. I think I require special tutoring from Doctor. We'll do this post our session right now, but thank you. Really means a lot to me.
Thank you for giving this opportunity. It was a great time talking to you and to my viewers. Thanks a lot, and looking forward again for more.